The company that I made is called Vaughan Family Dental. So just to continue about my company, it is a dental clinic and the name is Vaughan Family Dental and the location is in Vaughan, Ontario. The owner and CEO is Jessica Alsaig, which is me, and the company slogan is Feel Confident About Your Smile. So just a bit about my company and the mission statement. As stated here, Vaughan Family Dental Clinic is a dental clinic that provides complete dental care to the highest standards of treatment, personalized to each and every client. Our company strives to not only meet your needs, but to exceed your expectations. Our company provides the newest and highly effective instruments and sterilization equipment, as well as the highest quality trained dentists, dental hygienists, dental assistants, and also dental administrators. We strive to give our clients the knowledge and great skills to improve their oral health, appearance, self-confidence, and moreover, improve their quality of life. So just to continue, some health and safety issues that I discovered during the research process. Some of those were increased risks of eye respiratory infections as well as rashes are easily transmitted in the dental setting. Tooth sensitivity during debridement, risk of experiencing syncope, which is fainting, and lastly, radiation from the dental professionals taking radiographs. So the health issue that I want to focus on for today's presentation is the infection control and risks of getting diseases and the transmission of bacteria and microorganisms. So just a little bit about that. Infection control is defined as a comprehensive, systematic approach designed to prevent the transmission of infectious agents and bacteria. The goal of infection control is to create a safe environment. And standards precautions are actually a set of infection control precautions used consistently for all clients, regardless of their infectious state or health status or history, to ensure the safety of oral health care. And lastly, the CDC, which is a government agency, that is the Centers of Disease Control and Prevention, and their mission is to promote health and quality of life by preventing and controlling disease, injury, as well as disability. So just a little bit about the roots of disease and organism transmission. So there can be disease and organism transmission by direct contact, which an example of that is coughing. Indirect contact, which could be using a disposable or unsterile instrument. Droplet contact, so that's like coughing as you exhale, any liquid that gets transferred to any substance, and inhalation. So what can we do for our patients in the chair? So a few things that we can do for our patients to reduce the risks of bacteria and microorganisms is using a high volume suction and the use of a rubber dam. So efforts should be made to prevent the spread of droplets, splatter, and spray created during dental procedures. With that being said, a rubber dam should be used whenever possible, and a high volume suction should be used whenever the creation of droplets, splatter, and spray is possible. The use of rubber dam and high volume suction also minimizes the ingestion or inhalation of contaminated material and debris. And a bit about pre-procedural rinses. So any pre-procedural rinse, such as Listerine Zero, does reduce the level of microorganisms in the mouth that can enter a client's bloodstream during a dental visit and cleaning. And so during a professional cleaning, debridement and polishing instruments, such as low-speed hand pieces, polishing cups, as well as ultrasonic scalers, do make splatter and aerosols that allow microorganisms to leave the mouth and contaminate clinical surfaces, instruments, as well as personnel in the treatment room. So just that use of a pre-procedural rinse does minimize all that bacteria and the microorganisms from spreading and being able to cause that pathogenic disease. So what can be done for a client exposed to others in the waiting room? So receiving dental care, there is a possibility that clients with suspected febrile respiratory infections, as well as rash and eye infections, can transmit to other people. So that being said, in most clinics, there's not many available disinfectant agents aside from an alcohol-based hand rub. So with that being said, some additional protective recommendations that we can offer in my clinic will be masks in the reading room to ensure your safety, as well as additional disinfectant agents. So any disinfectant agent that you may want to wipe down chairs or anywhere where you'll be touching, just to make sure that you are not contaminating yourself with the contaminated surfaces. Next, the sterilization of instruments. So at my dental office, what I'll be offering is adequate space for loading and unloading and cooling down of instruments to be sterilized, biological indicators and incubators for conducting spore tests, enclosed storage for sterile and single-use disposable items. Heat-tolerant instruments are sterilized by steam under pressure, so that an example of that is autoclaving. And lastly, I'll be following manufacturer's recommendations, so making sure that all instruments are sterilized to the highest capacity, and that being said, all of my instruments will be uncontaminated. So monitoring of sterilization must be conducted through mechanical, chemical, and biological means, which evaluate both the sterilizing conditions and the procedure's effectiveness. So to conclude, there are many different types of infections and individuals that can be exposed to, including dental professionals. So dental professionals must wear adequate PPE, so that's like safety glasses, gloves, as well as a mask, in order to avoid the transmission of infection or disease. And as individuals are at risk for catching infections in the dental office, we will be providing additional masks as well as disinfectant agents at reception for patients' use. And lastly, for our clients in the dental chair, we will ensure that all our equipment is sterilized to the highest degree. We will do this by continuously getting our sterilization equipment professionally checked with integrator strips and keeping each cassette of instruments with their sterilization log number that will then be placed in a logbook. And that is everything. I hope you enjoyed my presentation, and here are my references. Those included the College of Dental Surgeons of British Columbia, as well as Colgate. Thank you for listening.